Fungi can cause a number of lung conditions, characterised either by infection or by allergy. This review describes an endotype of Airways disease, which we've called Allergic Fungal Airways Disease, or AFAD for short, which is caused by IgE-sensitisation to thermotolerant filamentous fungi such as Aspergillus and Penicillium species, which can germinate in and colonise the airways. It also touches on fungal bronchitis, which can complicate AFAD. AFAD is defined as IgE sensitisation to thermotolerant filamentous fungi in the presence of Airways disease, particularly cystic fibrosis and asthma, but also bronchiectasis and COPD, and sometimes even in the absence of an obvious underlying Airways disease. This Venn diagram shows the relationship between the inclusive AFAD and the exclusive terms ABPA and SAFs, which are in common parlance, as well as with allergy to non-colonising fungi. AFAD can present heterogeneously in a number of different ways other than just ABPA and SAFs, and the presentations are listed in this slide. Pathogenesis of AFAD is that of a vigorous, persistent type 2 allergic response with marked eosinophilic inflammation and high levels of IgE, as well as the effect of proteases and other fungal proteins which can cause epithelial damage and effects on airway smooth muscle, such as ALK1 and gliotoxin. The management of AFAD is that of the underlying airways disease, with the additional focus on avoiding fungal exposure and effective management of exacerbations, which can lead to lung damage, such as bronchiectasis and fixed airflow obstruction, which is the hallmark of AFAD. In our experience, and based on our reading of the literature, antifungals do not have a routine place in the management of AFAD, but are helpful where there is fungal bronchitis characterised by production of brown, purulent mucoid sputum where there is growth of Aspergillus or Penicillium species. AFAD is a not uncommon complication of airways disease, which carries serious morbidity and increased mortality, and needs to be recognised and effectively managed.